and provided survival with Becacizumab in advanced cervical cancer. UCSG Nursing Course CHEME Cycle Name Tatiana Diaz CHEME Master John MOSCOSO 2080-40. Definition: the cervical is affected by cervical cancer. An specialized cell affected by this cancer is the squamous cell, and special king of the epithelial cell. Glandular tissue also affect the organ affecting cervical width in a part of the reproductive system.
The staging of cervical cancer refers to the extent of the disease. Doctors stage the disease according to the size of the tumor and whether it has spread to nearby tissues or other organs of the body. Stage 0 is not considered invasive because the cancer cells are found only in the top layer of cells of the cervix. Stage 1A is considered invasive cancer because the microscopic tumor grows through the top layer of cells into the underlying cervical tissue and is 3 to 5 millimeters deep by 7 millimeters wide. Stage 1B cervical cancer has two scenarios. One, where the tumor still can only be seen with a microscope, but is larger than 5 millimeters deep and 7 millimeters wide. In the second scenario for stage 1B, the cancer can be seen without a microscope and is larger than 4 centimeters in diameter. In stage 2A, the tumor spreads beyond the cervix to the upper 2/3 of the vagina, but not to the tissues around the uterus. In stage 2B, the cancer spreads to the tissues around the uterus. In stage 3A, the tumor spreads to the lower third of the vagina. In stage 3B, the cancer
Application in medicine. Cervical cancer can be detected. There are systems for this type of cancer. These systems include abdominal bleeding for the vagina, bleeding after menopause, bleeding starting and stopping in the weaning period, wherever. There are many ways that cervical cancer can be diagnosed.
Hi, I'm Dr. Kate Grossman for About.com Health. Your doctor just told you that you had an abnormal pap smear and that you need a colposcopy. You don't know what to expect, and you're scared. Hundreds of thousands of colposcopies are performed every year in the United States. Most of them are to investigate an abnormal pap smear. In 98 out of 100 cases, cancer is not found. You should avoid putting anything in your vagina the day before the procedure. This means no spermicides, no sex, no yeast medications, and no douches. You'll be asked to lie on your back with your bottom at the edge of the table, your knees bent, and your feet in the stirrups. The doctor inserts the same type of speculum used in a pap smear to help better examine the cervix. This may be unpleasant, but it shouldn't hurt. The doctor uses a special lighted microscope called a colposcope to examine your cervix in detail. The microscope will not enter your body. The doctor applies a vinegar solution which interacts with the cervical cells and aids in the identification of potentially abnormal areas. This may cause some mild stinging. If a potentially abnormal area is found, your doctor may take a biopsy, and you may feel a pinching or cramping sensation as this happens.
Pros and cons. Cervical cancer has a few preventive measures. The only way to prevent this cancer is to treat precancerous cells before they become actual cancer cells and avoid contracted precancerous cells and HPV. There aren't many preventive measures for this cancer, but there are preventive of treatments.
Cervical cancer is diagnosed usually in a gynecologist's office. In the usual course of events where cervical cancer is diagnosed, it is usually picked up on a screening pap smear, which shows an abnormality, which then results in an examination by a gynecologist called colposcopy, where an examination in their office is performed, where with binocular microscopy we evaluate the cervix and take directed biopsies of abnormalities that we observe. Those biopsies are then looked at by a pathologist under a microscope and then render a diagnosis as cervical dysplasia, otherwise known as the precancer or precursor lesions of cervical cancer. Sometimes, unfortunately, it's diagnosed as an invasive cervical cancer.
This is the chance of recovery from cervical cancer or the prognosis of the cervical cancer depends on the stage of the cancer. Based on recent studies, 71% of women with cervical cancer survived for at least 5 years in general. With treatment, 80% and 90% of women white on the early stage of cancer, 60 and 75% of women with advanced stage on treatment cervical cancer with survival for the last 5 years.
Stage 1 and some specific stage 2s, we tend to use surgery for those treatments, and that can be anything from a conservative operation, meaning where the uterus is left in place, such as what's called a conization, where we excise the abnormality only on the cervix and leave the remaining cervix and leave the uterus in place. There are other options for that, which is called a trachelectomy, which is a procedure where the surgeon removes the cervix but leaves the uterus. And we use that treatment modality in patients that have invasive cervical cancer that desire future fertility. Furthermore, as we get into more advanced stages or in patients that fertility is not desired, a hysterectomy is performed. And based upon complicated issues with regards to what the stage is and the cell type, sometimes a traditional, what we call a simple hysterectomy is performed, which is one that a general OBGYN performs.
Thanks.